But the country leading in cases is the United States. More than 950,000 Americans have tested positive for the virus. Over 54,000 have died from COVID-19. Despite the rise in cases and deaths, several U.S. states are now easing restrictions. Businesses are being allowed to reopen. But as Jennifer Johnson explains, many owners and consumers are reluctant to leave their homes.
State by state, city by city, a chaotic reopening of businesses across America. The governor of Texas is expected to issue his wide-ranging order Monday. But in Wichita Falls, Texas, officials jumped the gun, reopening all businesses Saturday morning, still requiring face masks and social distancing.
This order is not forcing businesses to open. This order is allowing businesses to open.
After Georgia started reopening several businesses Friday, Savannah's mayor pushed back and says he was threatened with racist emails.
Our common enemy is not each other. It is called COVID-19.
Georgia and other states ignoring federal guidelines, which require non-essential businesses to stay closed until there is a decline in the rate of COVID-19 infections for 14 days. Tony Roberts welcomed customers back to his barbershop after 6 long weeks, somewhat reluctantly.
I was baffled at the governor's announcement, I'll be honest, because there's still people dying and the numbers are still going up.
U.S. President Donald Trump staying unusually quiet. The president is facing criticism after comments about injecting disinfectants into the body as treatment for COVID-19. New York's Poison Control Center says it had to manage 30 cases of possible exposure to disinfectants after the president's words. At the White House, his economic advisor did talk with reporters, sounding the alarm again about America's growing unemployment rate.
Yeah, I think the president and all of us are very, very concerned that we've got this massive, massive shock to the economy that's completely unprecedented, and it's going to be a very heavy lift to get the economy going again.
But studies show the majority of Americans are still reluctant to leave their homes, and some business owners are not taking any chances.
I think the concern would be is if we open up too soon, then we find ourselves in a similar situation in a couple months.
Health experts continue to warn the rush to reopen could have deadly consequences. Jennifer Johnson, Global News, Washington.
For those living in conflict zones in the Middle East, getting vital aid is even more difficult in this pandemic. Just this week, roads to a Palestinian refugee camp in Lebanon were cut off after cases of COVID-19 were confirmed in the camp. As Crystal Goomansingh reports, aid agencies fear the youngest will suffer the most.
In conflict zones, aid agencies negotiate and plead to get food, medicine, and basic supplies to citizens. The pandemic has added another hurdle.
In a displacement camp with 60 or 70,000 people living in tent, highly densely populated, I don't know what we would do if the virus actually makes it to the camp.
A COVID-19 related death was recently reported in northeast Syria. With a 10-year-long war, the country is isolated, so that might provide some protection in terms of imported cases. But there's also a lack of testing. The World Health Organization has Syria with roughly 40 cases. Surrounding countries have hundreds or thousands.
They're saying, I don't know what to do with COVID. Like, I cannot escape a virus. Even if I'm in my tent, it may find me.
Fearing the virus, refugees who risk their lives to make it out are turning around, choosing instead to shelter in their old, often destroyed homes. Save the Children continues to work in Syria. It stopped bringing kids together for school, instead using online and radio. But that is a challenge in a war zone. Many aid agencies are sounding the alarm.
The Middle East for UNICEF was already the place where 50% of our global humanitarian action was taking place. We have 25 million children in the region in need of humanitarian assistance, so there was already a vulnerability. And now COVID-19 comes on top of that.
In Yemen, there are concerns over a 5-year-long war despite efforts to end the conflict in order to fight COVID-19. A ceasefire has been extended by 1 month, according to Saudi state TV. However, it's not known if Houthi fighters will accept it. There are fears about what will happen if the virus spreads to the battered country. UNICEF is appealing for $92 million to address the pandemic virus in Syria, Yemen, Iraq, and Sudan.
These people have nobody else to help them if they don't get help from the international community.
Children, the experts say, are the ones who suffer the most. and they have already endured too much. Crystal Goomansingh, Global News, London.
There's so much information surrounding coronavirus out there now. We know you have questions. Email your questions at globalnews.ca. Tune in to Global National or go to globalnews.ca/coronavirus now to find the answers.